welcome to our day 3 of our Interfaith Symposium. Thank you so much for coming and being with us this morning. Today we have Neysa, Etienne, and Michael Dougherty from RWJBH, Clara, Maass, talking to us today about mental health consequences of COVID-19 and physical distancing. This symposium is brought to you by Family Connections ADAPT Coalition and the Interfaith Committee, the County of Essex, and the Essex County Prosecutor's Office. So for those that maybe this may be your first time with us, or you don't know too much about us, we are a prevention coalition, reducing substance abuse and improving the overall health of all residents in Essex County. The ADAPT Interfaith Committee empowers the faith-based leaders of Essex County to understand and engage in issues affecting overall wellness in their communities. Our chairwoman is Clara. She's on one of our hosts here and one of our panelists. She's waving. We also have our vice chairman, Michael Dougherty, who's also present with us as well, and Secretary Demetricia Barnes. So just a little bit of housekeeping. Your participant audio and video will be turned off during the presentation. However, please use the Q&A box throughout the presentation to post your questions. After the presentation, we will have opportunity to answer your questions. We can also, if you raise your hand or you ask in the chat box, we can also have you ask your question as well if you want to do it verbally. The webinar will be recorded and available on ADAPT's YouTube channel. We are also going to be going live on YouTube. Also, there will be an evaluation that pops up at the end of the webinar. If you can just complete that, it's very short. And for attending today's webinar and each webinar, you'll receive 2 entries for our raffle on October 29th during our closing remarks. For participating in our resource fair, which is the second part of the last session of our 4-day symposium, you will be able to receive 5 entries. Okay, in our resource fair, we're going to have various providers from prevention, substance abuse, and mental health talking about their services and how they have adjusted to COVID and what kind of information that they have for everyone. Okay, so. So we do have a hashtag that we're using for the symposium. It's 2020 Interfaith Symposium. Please, if you can take a picture of your virtual symposium experience, either your setup, or if you want to post about something interesting that you learned during the symposium, please feel free to post that. Just make sure to add hashtag 2020 Interfaith Symposium and tag us at Essex Adapt. Okay, we are on Facebook, Instagram, Twitter, and as well as YouTube. Okay, so at this point, I am going to make it live. So just give me a moment to figure that out. Okay.
Okay. So say welcome to everyone, and thank you for being here. Jessica, thank you for having us. My name is Neysa Etienne. I am a licensed associate marriage and family therapist, and I also currently work as a mental health screener and child specialist here at Clara Maass Medical Center in Belleville, New Jersey. And basically, I'm here today to talk about adapting through COVID and how we can support children's mental health during the period of quarantine, as well as the transitioning back into school. So we'll be talking about some of the highlights that I'll touch on are the impact of social distancing. We'll talk a little bit about the stress of starting and returning to school as well. The other things that I'll touch on are the signs of stress, normal stress reactions versus red flags or warning signs of anxiety or depression. And then we'll talk a little bit about some coping skills, some tips for adults, and things that we can do to help children manage their emotions and anxiety during this time. And then in the end, we'll touch a little bit on the importance of self-care as well. The idea is hopefully that, when you walk away today, you walk away with some kind of, hopefully at least one valuable piece of information, whether it's something new or a fresh refresher, some kind of reminder that will hopefully, help you in your work or even, personally, because we're all kind of going through this together, whether in our careers or through work, and we're even either working in this field helping others, or we're experiencing it, on a personal level. So as it relates to social distancing, I would like to say that, it's unfortunately, but, in order to contain the spread of COVID, we've had to practice social distancing. And most of us, for the very first time in our lives, have had to quarantine or even learn what quarantine really means and what it's all about. And although this may be, a needed effort in order to minimize the impact of the virus, it is important to discuss the impact or the adverse consequences of social distancing, because there's always two sides to a coin, right? We have, usually there's a positive, but there's usually another side as well. And it's important to look at all sides. So some of the adverse consequences of social distancing, when we look at it, some of them would include the separation from loved ones, limited social interaction, restrictions on mobility and daily activity, disruption of routines. And all of these, when we look at them, are very important factors, especially for children and their development. When we think of school, there's obviously the academic piece, but all the other pieces that are very important are the ones that that we're seeing right here, that are actually not related to academics. Special attention is needed for at-risk youth, or those who are struggling before quarantine. And so that's something that's very important, not to say that it doesn't have an impact on just the regular population and all people in general, but definitely special attention for anyone who was already struggling or having issues prior to COVID-19. And this would include children with pre-existing social emotional conditions. So if you work in a school, or if you have children of your own, if there's a child that already, has an IEP or has a classification, these are children that are obviously going to be more at risk of struggling during this time. That would, for example, a lot of what we're seeing is children that are on the spectrum. That's, one example, that, are used to having all these supports in place, right? They have their routines, they have all their supports in class, very structured support. And then now they're home and all of that is gone. It's going to be very challenging, not just for the child, but for the family, for the parents or the caregivers. And then just, family issues, if there's domestic violence in the home, if there's poverty, these types of families, these types of children are the ones that are going to struggle, even have a more difficult time. A lot of times in working with kids and families, I remind a lot of the parents, or even because I've done a couple of these presentations and I've spoken to parents as well as, different people in the field that are working with children, and remind them that, for a lot of children, this is, the school setting was where they obtained most of their structure, or safety. Even for some children, this is where they felt safe. This is where they felt comfortable. And now a lot of children don't have that piece. So the fears about being infected or losing a loved one, the actual, impact of the virus itself, can also increase to the stress during quarantine. So the more that a child is worried about being infected, or worried about their family getting sick, or if they had loss in their family, those kinds of things are going to make the quarantine and the isolation even more difficult. it's important that, you know, we assess as adults or parents, that we assess our own stress levels and anxiety to make sure that we're not passing on our own stress to the children. And I would say that this is probably one of the most important things to look for, because a lot of times the children are experiencing stress and anxieties that we're having, and they're very smart. Children will pick up on energy, they will pick up on all kinds of messages, verbal and nonverbal. And the more anxious that we are, the more nervous that we are, the more worried that we are, the more that children will experience those kinds of emotions and those kinds of stresses. And it's hard because we're human, right? So we're all having these fears, and we're all having these worries, but there is an important, you know, it is important for us to remember to take our own temperature and just make sure that we're checking on ourselves, making sure that we're okay, because that's going to help the children adjust. So as it relates to returning to school, there's going to be a lot of similar, you know, emotions. Children that are returning to school, it's important for them to remember that under ordinary circumstances, it's already kind of nerve-wracking, right? So this is usually the toughest time of the school year. It's the beginning of the school year, both for children and for the teachers. So the start of the school year is considered the hardest. It's exciting, it's stressful for everyone. So it is important that we try to remind children that some of these feelings that they might be having about going back to school could be some of the normal feelings that they would be having on a regular year. It doesn't automatically mean that it's because of the pandemic. It's very normal to be nervous in the beginning of the school year. Teachers are usually very overwhelmed in the beginning of the school year. So it's, you know, to put that into perspective may help to alleviate some of the stress. And it's helpful because at least that way we'll know not to panic and automatically assume that it's anxiety because of the pandemic. You know, it's already going to be a stressful time every year at the beginning of the school year. And the normal worries that children have, right? They're going to have a new teacher, they're going to have a new grade, there's going to be more homework, making friends, making a team. All of these things are still very stressful. And these are the things that they're still probably worried about. And now there's COVID-19, and it's a new worry, but in reality, it is a normal worry. It's normal to worry about COVID. It's going to be on the list of new worries for children now, and for us. So the fact that we are worried about COVID and going back to school is okay. You know, that actually is normal. So we have to approach it kind of similarly to how we approach our nerves about having a new teacher, our nerves about, you know, the grades increasing, how, you know, we have to kind of try to see it in that way as well. So some of the normal responses and behaviors that we might see in kids are, you know, they may experience butterflies. We may see some like clingy behavior, physical symptoms like complaints of stomach aches or headaches, nausea. School resistance is very familiar, expressed worries. Children, obviously, the older that they are, the more they're going to be able to communicate and tell you what they feel and what they're worried about. We all experience worry or some level of anxiety, and we're all going to experience it very differently. We're going to see it very differently. And if you have more than one kid, if you're a parent, you know that you might see it, you know, manifest itself very different, even between your own children, right? So it's only when the symptoms are overwhelming or persistent, or that they're impacting everyday life, that they're considered red flags or a concern, right? That they may require additional attention from a professional. But it is expected that we're going to see some of these changes in behaviors. So red flags are really they're here to warn us, just to give us a heads up and let us know, okay, maybe this is something that we need to tend to, that we need to do something about. And there's different types. So there's emotional, there's physical, and then there's behavioral changes that could indicate that there may be a problem or a reason for concern. And children and adults display very similar behavior. So some of the things that we'll see in children, we'll also see in ourselves or experience in ourselves. Again, like the physical signs would be headaches, stomach aches, sleep or appetite disturbances. And this could be either eating a lot more than usual, or not eating as much, right? A decrease in appetite, and fatigue, more tired than usual, or agitation, just being more irritable than usual. So these are some of the signs that we might see. Emotional signs that we might see could be anger, sadness, worries or anxiety and fears, unfocused or poor concentration, unmotivated behavior. And some behavioral signs we might see are crying, isolation, procrastination or avoiding responsibilities, alcohol or drug use, new alcohol or drug use, or increased alcohol or drug use, increased arguing with friends or family, increased nervous behavior, so nail biting or fidgeting or pacing. Again, some of these things, you might have a child that's already a nail biter. You know, prior to COVID, you might know of a child, or you yourself, you might already be a nail biter, but an increase, right? A dramatic increase, and to the point where it's alarming, it's concerning. So younger children tend to display more clingy behavior or regression when under stress. That's very normal to expect. With older children, we see more of like the anxious or angry or restless or withdrawn behavior. So that's why we see, especially now, I think that with a lot of parents that are, home, going back to work or going back to school, we're going to see children that are going to have a harder time with the separation, which is expected. It's expected. It's going to be some of that. It's how extreme it is that's going to be what we have to look for. And this is kind of basically the explanation of that. So when symptoms are extreme or excessive, when they're long lasting, when they're impacting the ability to function at home or at school, that's when we really look at it as a red flag, because again, it's expected to see changes in behaviors and anxiety right now and depression. But when we see them to the level where it's impacting the ability to function, it's more of a concern. When they're long lasting. So for example, when a child starts daycare, I used to work for early intervention, and I used to work for daycare. So I used to work with very small children. And we knew that come September, all we were going to be hearing in the hallways was crying from September through October, maybe even November. It's, the children are adjusting to, especially the new children, the children that had never been in daycare before. So that's typical. That's, it's stress, and, obviously the children are anxious, but it's normal anxiety. It's expected anxiety. Now, if come December, January, February comes, end of the year is coming, that a child should be adjusted after a certain period of time. So once the new year comes in, if there's a child that's still extremely distressed about separating from their parent, that's when it would be a red flag. And maybe that's when it would be time for the teacher and the family and, to have a meeting to discuss, okay, what can we do? What's going on that's causing this child to have such a difficult time with separation? And is there anything we could do, and come up with a plan? So it's very similar with other behaviors. Whenever we see that it's lasting too long or it's too intense, that's when we can kind of figure that it's more of a concern. So biting nails, is it the most terrible thing, right? If we are biting our nails a little bit more, no, absolutely not. But if it's to the point where, I'm bleeding, I'm getting an infection in my finger, right? I see that it's too excessive, then now, yes, we have to look at the fact that it might be a concern. So being anxious about COVID is expected. Some changes, again, in appetite and sleep, those are normal. But if it's extreme, then yeah, we do need to maybe talk to a professional or get more information. Did I go back too quick? So one of the things, sorry about that. One of the things that do obviously support the ability to get through a lot of this is resiliency, the ability to overcome, right? And we all have a certain level of resiliency, but some more than others. And basically, it's the definition of resiliency is the ability to bounce back from a negative experience or from a difficult challenge. Because we all experience things so differently, and because we all kind of cope and recover very differently, it's all going to be, we're all going to see very different levels of resiliency. But we can build resiliency. So we'll move on to talk about some helpful tips. And basically, one of the tips that I would offer is, in general, planning or preparing or giving information in advance as much as possible. It does help with confidence, and it helps with reducing stress. So when you think about it, when you go to have a procedure, you go to a medical, appointment, you go to a doctor, you're going to have an operation, you're going to see a dentist. You want information. Before I go in and I see the dentist, I want to know, okay, how long is the procedure going to take possibly? Is there a chance that, what am I going to have to pay, right? Is it going to hurt? Am I going to get anesthesia? How long is the recovery, or even just to tell me, I don't have an answer for these questions, but, at least, we like to feel that we're being told as much information as possible as we need. It helps us to feel safe. So with children, it's very similar. I think that preparing them, giving them information in advance, appropriate, information, the needed information, and age appropriate information, it does help with preparing children. So definitely, again, providing with needed age-appropriate information, explaining to children things in advance as much as possible. For example, as it relates to school, what the school year would look like. So a lot of children have started to return, but some, I think, are still doing a lot of the virtual. So it's important, if possible. I know that some schools did a really good job at trying to do, virtual meetings with the teachers ahead of time and have different kinds of ways to get the children connected with their teachers and things like that. That was all excellent. So anything that could be done to kind of get the children connected and informed of what things will look like is very important. Even when you think about it, even as adults, when we go to work, we like to know what our day is going to look like. It's hard on us when things are thrown at us, and it kind of, creates stress sometimes when we have to really constantly be adjusting, and things are kind of unexpectedly, kind of falling onto, our plate for the day. So it's adjustments that we might have to make, but it's definitely, the more that we can plan in advance, the better that it is. And let them know that plans may continue to change. So it's important to have that heads up, because at least that way they can prepare, and they know, look, we don't have all the answers. We don't know exactly what the school year is going to look like. This is what we think it's going to look like, but there may be some changes, and that's very important that they have that notice in advance. If a child is concerned, it's important to ask him or her about, a time that they had to adjust to a change, and ask them about what helped them to cope. A lot of times we like to offer tips, and it's obviously it's great, and some children welcome it, but it's also good to ask them and see if they can come up with ideas of what's helped them in the past. Maybe they can offer something that we didn't even realize, would be helpful to them. So helping children to focus on things that they can control, because so much is out of our control as it relates to the pandemic. Focusing on the things that we can control is important, like hand washing, wearing a face mask, and then trying to social distance in a healthy way will help, because there's going to be a lot of questions that we don't have answers for. So trying to focus on the things that we do have answers for and can control. And I did speak about the importance of assessing our own stress, right, as adults, and always listening and watching. Children are always listening and watching, so we have to kind of, be mindful of what we present, what information we present to them, and what messages we're sending to them, because they pick up on all of our fears. So as it relates to school refusal, I just wanted to give a little bit of information or tips. It is understandable that this is very difficult for parents, to send their children back to school. They have a lot of concerns, rightfully so. And, it is also important to keep in mind that not sending a child to school You know, it's understandable because if a parent doesn't send a child to school, it does alleviate the problem at the moment. You know, the concern with that is that, you know, it may create a longer problem, you know, in later on. So, you know, because it does alleviate the problem at the moment, a lot of parents do give in. And this is even before, you know, unrelated to pandemic. A lot of times when children resist school, you know, they're kept home by families because, you know, it solves the problem immediately. But it is important to kind of come up with a plan because it can create a bigger problem, you know, later on in the future for the child and for the family. So it is important that physical symptoms are not ignored. Obviously, if a child's complaining that they have a headache or a stomach ache, a pediatrician or a specialist should rule out any medical issues. However, the most important thing that a parent can do when a child resists going to school is to send them anyway. You know, this typically, you know, obviously this is a little bit, you know, up to the discretion of the parent with the pandemic, but there has to be a way to kind of figure out how to plan around it. And maybe work with teachers and staff and see, you know, what's the plan to eventually get back to that. Because not sending a child to school consistently in the end does more harm, and it can reinforce certain behaviors or anxieties. It can be sending a message that avoiding things that make us afraid is a good solution. And it sometimes is. If there's a bear, I'm not gonna walk into a cave, right? So that in some circumstances, absolutely. But we want to make sure that is the current situation, that is the absolute needed decision, and that it's not because we're anxious and we're afraid, and it's actually a safe thing to do. Another tip would be helping children to have healthy perspectives. So there's not necessarily that there's a right or a wrong perspective, but there are some that are a little bit more healthy and will help a child adjust a little bit more. So the point of view that we have, you know, will affect our mood and our behavior. So having a healthy perspective will help to nurture resilience, as we were talking about before. And parents and you know, adults, we can help to do that. We can help to be an example of practicing healthy perspectives. So for example, one perspective that could be very helpful is to remind children that this is temporary, right? As hard as it is on all of us, as hard as it is to get through this, you know, it's not going to be forever. Nothing is forever, right? It's temporary, and we don't know how long exactly, but it's not forever. The other thing is to remind children that we're all in this together. You know, they're not alone. You know, I know that you're stressed. I'm stressed. You know, I'm stressed too. We're all going through this together. You're not going to go through this alone. As well as taking care of the mental approach to things is the physical, and helping children, making sure that they're taking care of their bodies, right? That they're getting good sleep, that they're eating healthy, that they're being physically active as much as possible, that they're staying hydrated, getting sun as much as possible, and manage screen time. All of these things contribute to social emotional well-being. And a lot of times we forget that how connected they are. But if we're not sleeping well, if we're not eating well, you know, we're not feeling well most of the time. You know, I can't tell you how many times we have patients that come into our emergency room because they haven't slept in a couple days, and the impact that has on our mental health. So it is very important that, you know, children are getting proper sleep, that they're eating well, and taking care of their bodies, you know. And, you know, with that being said, is that we remember that we're examples of that. So if we're up all night, right? If we're up all night on our tablets and watching movies all night, it's harder. It's harder for kids to not do the same, right? So if we're practicing healthy, you know, habits, it's easier for us to be able to reinforce that with our children as well. A couple of do's and don'ts that I would just, I guess, suggest. I would say don't downplay the seriousness of COVID. A lot of times, you know, the intention is to help people not to be nervous when we tell them, you know, it's not that serious, it's not that bad, but sometimes that can be counterproductive to try to downplay it. I think instead it's okay to say, to be honest, and provide, you know, necessary but age appropriate information. Don't tell children, you know, there's nothing to be worried about. Statements like that sometimes, you know, can unintentionally dismiss their feelings. The intention is good, right? We're trying to tell them not to, we don't want them to worry, but telling them that there's nothing to worry about can actually make them feel more worried, because now they're worried about why they're worried. Well, if there's nothing to be worried about, why am I feeling like this then? So it can trigger actually more anxiety when people are nervous or afraid and they're told, don't be afraid, don't be nervous. You know, instead acknowledge and understanding feelings and just listening and helping them to identify what they're feeling and validate their feelings. I understand that you're afraid, you know, this is scary, you know, what makes you afraid about it, you know, and, you know, what can we do? You know, is there anything we can do to maybe help you feel a little bit more, less afraid? But definitely trying to show understanding for their feelings would be very important and helpful. Another suggestion would be don't pressure children with formal or suggestive talks. Now, again, it does depend on your child. Every, you know, on the child. Every child is very different. But normally, you know, it doesn't really need to be a very formal or serious talk or a pressured talk to provide information and support. A lot of times, instead, it would be helpful to try casual talk. You know, a lot of times children will feel more comfortable and will tell you more and volunteer more information when it comes through that way. And self-care, the importance of self-care. In the end, you know, self-care is the practice of, you know, taking care of yourself and your own health, the practice of protecting our well-being and our happiness. And it's essential for everyone, but it's definitely very essential for anyone who's caring for other people, whether you're a parent, whether you're a teacher, you work in a hospital, you work in, you know, social work, any kind of, you know, you're a pastor, any kind of field where you're helping others and you're giving to others, you definitely need to prioritize yourself and taking care of yourself. It's kind of like I always use the flight attendant example. You know, when you walk, it's been a very long time since we got on a flight, but I'm sure we all remember when we get onto a flight, you know, and when we board, the instructions that we receive, and they always say, you know, who puts on the mask first? You know, if anything is to happen, you know, the parent, you put your mask on first before you put the mask on your child. And that's because if you're not okay, you know, you can't help others. So it's very important that we take care of ourselves first, that we put on our own mask, our own oxygen mask first, that we're eating right, that we're taking care of ourselves and our bodies, that we're prioritizing our sleep, that we're drinking water, practicing good coping skills, right? Eating healthy. And the other, you know, I think this is one of my last notes here, is just, you know, being careful with the information how much information we're absorbing. You know, there's so much now on the news, social media, it's everywhere, and we can't get a break. We can't get away from it. And, you know, and it's not just pandemic, it's so many things that we're seeing on the news that, you know, the more that we watch, it can actually have, you know, negative impact on our mental health. So getting the information, yes, absolutely necessary to be informed, right? But, you know, are we overdoing it? You know, are we actually doing more harm than good? According to psychological scientists, it says here, repeated exposure to traumatic images from the media could lead to mental and physical health problems over time. So what we're watching and what we're seeing and what our kids are watching and seeing, you know, is affecting mental health. You know, it's affecting anxiety, it's affecting sleep, it's affecting, you know, moods. So it is very important that we're aware of what we're watching and how much. And my last note would be just, you know, just to remind ourselves and remind our kids that it's okay to not be okay right now, to not be at 100%. We're all, you know, doing the best that we can. We're not, you know, this is a very difficult time. We're going through a lot of things, a lot of changes, a lot of adjustments, And we have to not be so hard on ourselves and expect us to be doing the best parenting that we've ever been able to do. Our parenting might not be exactly what we know it normally is, or we might not be sleeping as best as we normally used to sleep, but we're doing our best. We have to remind ourselves it's okay. We're just doing our best, and this is not forever. This is temporary. And that's pretty much what I have as far as information for today. I just wanted to leave some of the our information here from Clara Maass. It's we work for the Psychiatric Emergency Screening Unit here in the hospital, and we're available 24 hours a day, 7 days a week. It's a hotline that's available, and it's for crisis. So anyone who's having any severe symptoms of not just anxiety, depression, suicidal ideation, any kind of mental health crisis, you can go to your local, hospital, or call 911. And most hospitals do have crisis workers or screening services, but that's what we do. And if you have any questions, you can call us, get in touch with us. And thank you. Thank everyone for being here and for your time.
Thank you, Neysa. If you have any questions, just put them in the Q&A box. Would you like to answer questions now, or would you like Michael to go next, and then we answer all the questions at the end?
We can do it at the end. Michael, are you okay with that?
Yes.
Yeah.
Okay, great.
Yes, you can answer the questions now.
Oh, now?
If you want, whatever you want.
Okay.
One of the questions I did see was, will the PowerPoint slides be available to the participants?
I think we can email them. Maybe, I think you can send it out. Okay, you have it, right, Jessica?
Yes.
Yeah. Okay.
Great. Anyone else have any other questions at this point? I'm not seeing anything in the Q&A box just yet. Okay. So I think at this point we'll proceed with Michael's presentation. And then if there's any other questions that come up, well, we will answer it after his presentation is over.
Mm-hmm.
So Michael, would you like to share your screen, or would you like me to share the screen?
All right. First of all, I'd like to say thank you to Neysa for her presentation. I actually had some tears in my eyes at some point, thinking about my grandkids. I've come to the hospital to work every day during this pandemic. I've seen some dreadful things. Many of my good friends have gotten sick, and some have even passed. But on my mental health, the worst part of this has been not being able to see my grandkids. So thank you, Neysa, for that presentation. And that part of it for me has been the worst part of it. What I would like to do in our time remaining is just think about the impact of the COVID virus on our mental health. Now, I'm not sure who is online with us. I'm assuming that there are many of my friends that I've been out to meetings with and various functions who we've laughed and given that handshake and hug in the past. Let me tell you that I miss you, and hopefully at some point in time we can get back to it. I know that there's some of the ministers and administrators and people. I trust you're doing well, and that you will continue to do well. What I'd like to talk about for a moment is the impact of this COVID-19 on the partners of ADAPT, because being all professionals in the field, and then being family members, we're pulled in various directions. The COVID-19 has affected each individual in varied ways. There are those are clients, those people we're in charge of who are clinical and have mental illness to begin with. The impact of COVID has been devastating for them. Their fear of coming to the hospital throughout this epidemic, the census at Clara Maass for the mentally ill has decreased. It has dropped. People are fearful of coming. They're not getting the help that they need. They're having difficulty meeting with their therapists. Things are being done by phone. Anytime you're changing the process for the mentally ill, it becomes more difficult for them. And I'm sure that in your practices also, when you're dealing with those who are either mentally ill or addicted, touching them, getting into a place of therapy with them has become difficult. I'm sure we have some clergy on the line also. And I'm sure that dealing with your congregations and those people, the restrictions that we have been difficult. And that's for those who are diagnosed, those who have an ongoing mental illness problem. But then again, we're also dealing, aren't we, with those people who may not have a diagnosis. They're not in treatment. They're not taking medication. But COVID-19 has restricted their life and altered their life in a way that there are things that are happening. Your usual responses to daily activities and daily problems has to change. One of the things we are thinking about is when we're looking at this is the data isn't complete. The results are incomplete. We're getting some pictures of the effect of COVID-19 on the population from March, April through May, but it's not complete. There hasn't been time to gather all the data, but the early results do show us that COVID-19 has had a particular impact of mental health on many. As I said in the beginning with my grandchildren, it's been heart-wrenching for me not to be able to see them. Those of you who are online today who are a little chronologically challenged like I am, you know that the grandkids, that's the biggest part of your life. And you may be restricted from that. And it affects each and every one differently. I know that in your life, being that many of you are professionals, people are looking at you differently. They're looking at you for help, for support, for some information. I have stores that I go into on a regular basis. Now, these people know who I am, where I work, and it was always just a hi, how are you? Now they are pulling me off to the side and asking me questions. What's going on? What's happening? So the mental aspect for us as an ADAPT family and as professionals in your field has become more significant to family, to friends, and to our constituencies. What we want to think about are the things that have happened to us. Now, for the mentally ill, things like worry, fear, and isolation are something that they're attuned to. They're used to that. They have their coping skills for that. But for the rest of us, the worries and the fears that have come in are something different that we need to consider new remedies for each one of us and how we're going to impact us. Worry, fear. becoming stir crazy. Now, anxiety has risen a great deal. I know it has risen in your life and mine. I'm putting up a slide here of signs of anxiety disorder. These are usual signs of anxiety disorder. This is what people on a daily basis, those who have disorders or those of us who just go through life and things become anxious. These are some of the symptoms. But think about what's happened with COVID-19 and how that has impacted us. One of them is avoiding social situations. Avoiding social situations is a symptom, a sign of anxiety. People don't want to get involved. COVID-19 has caused us all to be avoiding social situations. We are told by those who we look to for direction on this that we're to stand 6 feet apart. We're to avoid gatherings that are not necessary. Those of you who are in the clergy or in the audience, your churches were stopped. You didn't see your congregations. You couldn't touch them other than maybe a phone call. Another one of them, as we're looking at it, is hoarding and collecting. Think about what happened to our society early on in May. The shelves were empty. People were grabbing toilet paper, paper towels, couldn't get them. So the normal symptoms of anxiety were exacerbated by this COVID-19. So I want you to think about that for your families, for your friends, but also for your constituencies, those people you work with, how that has increased in such a great way. One of the things we'll be talking about as we go on in a little bit will be the thought of consuming alcohol, self-medicating with alcohol. We'll touch that in a little bit. These are normal symptoms of anxiety without a pandemic: hoarding, avoiding, self-medicating, substance abuse. With COVID, it has increased exponentially. We're looking also at the thought of people becoming depressed. We're seeing an increase now at the hospital now that there was a decrease in the urgencies of COVID. People were coming, the hospital opened up for other procedures. People became coming back to the hospital. And even those who would not ordinarily be coming to the crisis part, we would be seeing them and they would be depressed. There are many people who have lost their jobs in fear of losing their jobs. What's going to happen? And so we get the, I got to go to this one. We're getting these symptoms, these emotions, these feelings of sadness, of loneliness, and of uncertainty that have been growing in our population. Many of the symptoms that have been associated with depression, and some varying on the individual, of course. Most common symptoms we're going to look at. Now, when we look at depression, we look at anxiety, we're looking at this in a way that there is clinical, there are people who are diagnosed, and then there's all of us. From day to day, there can be times when we will become anxious over something that's happening. There will be times when we become depressed. We don't look at it that way. We used to say, oh, he's got the blues today. He's a little down today. These are the symptoms of the anxiety and the depression that we're all dealing with. one of the things that we're thinking about here is a persistent sadness, a persistent anxiety, or an emptiness. And COVID-19 has added a great deal to us, to those people that we deal with, to our family members, that empty mood. I want to go do this. I want to go. I can't do it because I'm afraid, or it's been taken away from us. One of the things we deal with people who have chronic mental illness is that they lose their sense of purpose, they lose their individuality, they lose control of their life. It's been taken away from us. It's been taken away from the people that we deal with, our clients, our family members, our children. If you think about it, let me add one of the things that when Neysa was talking that concerned me. My grandkids we're not allowed to touch them. They're not, when they come to the house, and they've only come maybe 4 times since March, we're not allowed to go 6 feet close to them by their parents, and that's okay. That's their family. A month ago, 2 months ago, they were at the house, and the little one, Dante, 5 years old, we're out in the backyard, and he keeps looking over at his mother, who's talking to my wife. And he takes a step closer, and he looks over, and they're talking, and he takes a step closer. He got close enough where he could reach out and touch me. And he jumped back, looked over at his mother like he's in trouble. He had a need to reach out and touch. The people that we're dealing with in our families, in your congregations, your constituencies, your patients, we're all longing for that time when we can reach back, not feeling empty, and get back. And as ADAP members and partners, I think we can be looking at how we're going to be the ones that are going to help them do that. And hopefully we can help ourselves. I speak with some people who are still remote, still working from home. I wasn't given that task of working at home. I've been in the hospital every day, but there's a need for reaching out. Like my grandson, he needed to reach out. Even though it might have gotten him in trouble with his mother, he had to do it. So there's the symptoms we have, and it takes us away from our normal routine. It's not mental illness in the classic therapeutic clinical term. For a lot of us, it's just those emotions that go up and down. Well, we want to consider how we can, what we can do to increase in ourselves. As Neysa said, it's important to care for yourself so that you can care for your parishioners, for your family members, for the guy at the store who's just asking you questions about what's going on at the hospital, what's happening there. One of the things we want to consider in a great way is that thought of resuming. And again, that's taken away from us, isn't it? We have rules and regulations that have come. We'll follow them. We will social distance. We'll wash our hands. We'll wear our masks. We all do that. And we'll keep ourselves. But then there's the thought for yourself of beginning in your heart and your mind to begin to resume, finding ways to resume, so that those pleasurable activities, those things that are important to us, can begin to come back. They'll come back slowly. They'll come back in ways that are different for each and every one. But the encouragement is to begin to do that because COVID has certainly taken its toll on us in many different ways. As I said when I began, the stats, the data is a little short right now. They haven't had a whole lot of time and energy to put a lot of data together. The physical, the medical part of COVID has taken over rather than the mental health. As I said, at the hospital, our traffic for mental health decreased. People were afraid to come to the hospital. People are doing things remotely. But the CDC has given us an idea. Now, these are early stats. This is early data when they were doing their surveys. 40% of U.S. adults reported struggling with mental health issues. When I looked at that, it made me feel a little bit better. I can remember days waking up, coming to the hospital when it would just be dreadful. I said, I got to go there again. What am I? And then, of course, the things, as I said, dealing with the grandkids, dealing with this and that. We go up and we go down. So it made me feel a little better that I'm in the 40%. I'd like to talk to some of those people in the 60% who throughout this thing haven't had any problems, but maybe we'll get to that. CDC tells us that anxiety and depression, and these are people, just random people. These aren't people who have been diagnosed, who have clinical problems with mental illness. There's an increase of 31% of anxiety and depression. Trauma, stressors related to the disorder up 26%. And as far as ADAP being a primary part of it, either started or increased substance use, and that's alcohol and or drugs, up 13%. In March, one of the papers that I was looking at said that the online ordering of alcohol had increased 27% during the month of March alone. So people are looking at ways of trying to deal with this, and they're self-medicating with alcohol, with substance. And we want to think about it in this way. We're dealing with people who are hurting. There may be people who are listening and who are hurting. And it's been difficult for all of us throughout this whole thing. I would encourage you to remember, as Neysa said, that taking care of yourself is important to taking care of everybody else. Over 40%, 41% of respondents to their various surveys reported adverse mental or emotional problems. The COVID virus, I remember, I go back to my grandkids again, and I may not be able to get through this. In March, they locked down their house, and I had to bring them some stuff. And there's my grandson, 5 years old, standing behind a glass door, storm door, looking at me like, why are you out there? Why aren't you coming in? All of these little things that we're going through have a profound effect on our mental, emotional well-being. Sometimes we are unaware that this is happening. As Neysa told us before, it's important that we're getting in touch with that. We all saw a decrease in COVID, and we all breathed a sigh of relief. Now we're hearing that there's a spike. what does that do to us? What is it doing to our family members, to our community, ministers, to the congregation? It's important that we're understanding that we have a loss of control here. We're unable to grasp how we can remedy this. And on a daily basis, we're just trying to help. Those of you, if you're on here and you're not involved in ADAPT as a partner, know that there are many people involved in ADAPT in varied agencies and disciplines who have assistance and who can help children and adults. So we do encourage you, if you're there, to contact and to share what you have and share in the resources that ADAPT has. The impact on the mental and emotional aspect of Americans has lagged in response to the medical and the physical aspects of COVID. There's where the headlines are, in the people who are infected, in the people who have been, who have lost, we have lost. And we're caught up in a little bit of that, but it's important to remember that there's a mental and emotional aspect. The substance abuse, there's coming a day for COVID that they will have remedies for COVID. There will be medicines that they engender. There may be a vaccine that will come, and that part of it, that physical part of it, will be over. But the effects of COVID on the mental and emotional well-being of people, there's not going to be any medication for that. There's not going to be any vaccine for that. The substance, the problems, the residual effects of the substance abuse, those who have, as it says here, either started or increased their substance abuse, there's not going to be any medication for that. There's not going to be any vaccine for that. And we are going to be left with a lot of people who will continue to suffer in their mental and emotional well-being for a time to come. We're thankful that there are groups like ADAPT who are there to assist, and pastors and clergy who may be listening in, who will be able to help people. So it's the mental health issues that are going to be lasting. There'll be medicines, there'll be a vaccine for the physical, but for the mental and emotional aspects, they are going to linger and be with us. I do encourage each and every one, although the data isn't in and correlated well, we do know from just our observations that the mental and emotional impact has been devastating of COVID. The substance use has been devastating and continues to be. So I encourage everybody here and who is listening, take care of yourself. This was given to us. We didn't ask for it. And the residual effects that are coming, we'll be able to deal with, and we'll be able to work on the remedies that we all need individually and as a group. So we do encourage you. Neysa did put up on her PowerPoint our numbers here at Clara Maass. We are a helpline. We are a crisis line. You can call us. It's not just a clinical issue. There are people here 24/7 who will talk with you and will be able to give you referrals and information on where you can call. If you're calling for somebody else, we'll help you with that. So that it's important that we are beginning to address these difficulties that will come. Thank you, everybody, for listening. We're hopeful, Neysa and I, that we've been of some help and given you some information that will be helpful to you. We're here. You can call us. For those of you out there who have been my friends, and I've gone to all those meetings with you and all those dinners and all that, I miss you very much. And hopefully this monster will recede and we'll be able to gain again that usual, that normalcy that we're all looking for. Keep yourself safe. There still is a danger. Keep yourself well, both physically and in your heart. For the pastors out there, remember that scripture that's given to us in the New Testament, that God has not given us a spirit of fear, but of love and of a sound and disciplined mind. So we need to keep ourselves well physically, wash your hands. We need to keep ourselves well emotionally and mentally, and there is help for that. Thank you, Jessica.
Thank you so much, Michael and Neysa, for those two wonderful presentations. At this point, I'd like to ask if there's any questions. We actually have a few questions in the Q&A box, but if you would like to have your question answered, I'm going to present them. Okay, so the first question: what type of resources do you have for parents to assist students in returning to school? Do you provide small group counseling based on age and gender? We can't hear you, Neysa. Neysa. Oh, sorry.
I'm sorry, I forgot that I had muted. I apologize. I was trying to say that here at Clara Maass, unfortunately, we don't have any outpatient counseling services. We do work with a lot of agencies and we make a lot of referrals, so we can definitely get a list of places and maybe send something over of different places that provide counseling. A lot of places are still doing virtual, you know, so a lot of, but there are a lot of, I've seen, you know, virtual groups for supports of all types. So I can definitely look into that a little bit more, maybe get something out to you, Jessica, if that's okay.
That's great. Yes. And then hopefully in our resource fair, we'll also have some providers that can provide these services at our virtual resource fair on October 29th. So
Okay.
that would be great.
Okay. I'll write myself a note though, and I'll look for that for like a parent support group, because I think I might have seen something, and I'll get it over to you if I find it.
Sure.
Okay.
Thank you.
No problem.
Calvin says he misses you too. Demetricia, Michael, and Neysa. Okay. Great. All right. Second question. Some of our young children are so distraught with COVID-19 required norms. They may have really taken a toll on them. Some of them have been asking adult staff members if we still love them because we weren't hugging them or giving them high fives as we had in the past. This school year is very confusing for them. Aww.
It is. I mean, that sounds more like a comment, right, than a question. And so I totally agree. I mean, it's hard on everyone. It's hard on the adults. I'm sure the teachers and, you know, want to hug these children. You know, I'm sure that they want to touch them and play with them. And as adults, we understand more of what's going on than the children. So it's hard to explain to them. And we have to try to find a way to explain to them, you know, that this school year, you know, we have different ways of showing that we love each other. We have to do it in a different way to show, you know, affection, and come up with different ways. You know, maybe they can, as teachers are so creative, I tell you, like I could never the things that teachers do. But but I've seen so many different things like on Pinterest that when I go on to look at like what schools are doing of different ways that they can make even desks feel more comfortable. I saw one like preschool classroom where they turned, you know, they have to put the barrier, the plastic barrier or whatever around each desk in some of the schools, and they turned each desk into like a little school, like a little car, like a little, so it looked like a windshield of a car. So, I mean, there's little things, right, that you can kind of do to help children adjust and feel more comfortable and have a different perspective on it, where they're not just sitting behind a glass separated from everyone. Now I'm sitting in my car, you know, I'm sitting in my, so I think that, you know, really get, you know, the teachers, that they're amazing, and just kind of becoming creative with how to explain to kids and come up with ways of new ways, fun ways that we're going to show each other that we care and that we do love each other. There's going to be a new fun way and different way this year, you know. It's going to be hard. It's challenging. Yes.
There's a lot of creativity that has to come in.
Yeah, for sure.
So, if you would like to ask a question yourself, there's like a little hand or something on, you put it by your name on the chat, in the chat box. So we can unmute you if you would like to share either a comment or would like to speak with us. We're here and available.
Jessica, it's okay. I would just like to make a comment. I so appreciate, Michael, your concluding with the spirituality component, because that's significant. Our faith and our spirituality is one of the mechanisms that's safe and helps us cope. So I really appreciate your reinforcing that and maybe introducing it for some, because even for children, helping them have an understanding beyond their own capacity or beyond the capacity of the adults that they know, because they have to vacillate. I've seen so many children have to choose or decide, oh, it's okay to hug this one, but it's not okay to hug that one, or it's okay to be intimate within my family and maybe a little bit of extended family, but not this family. Or, you know, depending on the construct of your neighborhood, it's okay to hang out with this kid and play, but maybe not this one. So it is very hard for children to vacillate and to make decisions and to understand the complexity of it. Our responsibility as adults, again, being mindful of who we are and that we are well, is to help them navigate that. So I thank you for sharing that scripture. It's a foundational scripture, and helping people connect to faith and spirituality. That is a component of our wellness that during this time, hopefully we're not ignoring. Although there's still a lot of shutdowns, a lot of churches are not opening or may not be in the normal way of gathering or fellowshipping or meeting in person. So thank you for that.
Thank you, Glenera. Do we see any more questions in the Q&A or in the chat box? Okay. So at this point, we're going to proceed with the second half of our webinar, and I'm going to turn it over to Glenera to lead us into a little break before we get into our think tank discussion. So I'm going to leave it to you right now.
Yes, good morning again, everyone. And Neysa and Michael, thank you. Tremendous and great presentations. I believe, if I can speak for the majority of us, we look forward to receiving the presentations because it's some real concrete information that can help us personally and professionally. I appreciate Michael's journey in sharing his experience with his grandson, because that's our reality. You know, the family dynamic is the personal piece or community, and then we have the professional aspect, no matter how we're represented here. So thank you for everyone who participated. Looking forward to us having some good dialogue, hopefully between the Q&A box or the chat box. So one of the things I want to kind of do this time is take a little bit of a different approach. If you participate in previous segments of the symposium, we went into a time of kind of think tank, personal application, professional application. So what I thought we could do this time is let's start out with some of the realities of how were we challenged? How were we challenged in adjusting to COVID-19 when it came to our mental health, our behaviors, and even our emotions. I appreciate Michael providing those statistics. I'm surprised they're that low, Michael. I'm not questioning the CDC, but I kind of felt they were a little low just on my own survey of people I connect with and those that I was facilitating within the congregation in which I serve. That I thought it would be a little bit higher of individuals that had some type of emotional, mental, or behavioral response to COVID-19. But, as you indicated, it was a group of participants and that was the ratio that was provided. So if we can just start in the chat box, talk about some of the realities of what it meant for you as a person, what it meant for you professionally, what adjustments did you have to make or implement in response to COVID-19? Because let's start there. Let's start talking about what was the reality. What did we actually experience in response to COVID-19 personally or professionally, as was shared today from a mental health, emotional health, and a behavioral health perspective. So I'm gonna give everybody a couple moments to think about it. And if you can just start, placing your responses in the chat box or the Q&A, Jessica and I will be as responsive as we can, or feel free to raise your hand. We would love to hear your voices because we, again, as Michael said, we are missing each other terribly, terribly so. If we can't see your face, we would love to hear your voice. So we do have the capacity to unmute you to participate in this conversation, in this dialogue. Okay, perhaps I should reframe the question. What we're attempting to do during this period of time, during the presentation, is to discuss what were some of the challenges and how did we respond from a mental health perspective, from a behavioral health perspective, from an emotional health perspective to what transpired. And Neysa began talking specifically about children, the significance of their experience, their behavioral adjustments, their mental health, and even emotional health. We want to talk about what the practical piece is to that and what was some of your observations or your experiences, whether it's in the profession you work with, perhaps with children, or perhaps in your own family or community construct.
Kelvin, I would like to speak, so I'm going to give him the permission to talk right now. Okay, Kelvin.
Hi, Kelvin.
Kelvin, oh, I think you're on mute. Okay, yes, you're unmuted yourself now.
You can hear me now?
Yes.
Okay.
Yes.
It's interesting. One of the challenges that I've had is not growing up in the New Jersey area. I'm from Chicago. But I actually have acquaintances who feel like COVID doesn't exist. And for the friends that I've lost, those that I've seen who have been sick, it's kind of disheartening that the country is so split on this issue, or that there are pockets of people that think that this is not real. And it just boggles my mind that this can go on with, I don't, what's the number at 215,000 or whatever the deaths are and all that's going on. But I just find it mind-boggling that people still can push this aside like it's a common cold.
I'm going to agree with you, Kelvin. Thank you for sharing that. That is a reality. There are people around me as well. Maybe they don't discount it, but they minimize it. And they use comparison. And maybe everyone has had this, so I'm not pleading anything. I am not a medical professional, so I'm just speaking and responding to Kelvin. I want to make sure no one's not taking my words for anything other than being my perspective. Is that, a lot of people begin to minimize the communicability as well as the potential outcome. And like you said, Kelvin, when you have a loss, that's very hard.
Right.
Connect with someone who's downplaying, or in the case, as you mentioned, don't believe in its existence or the fatality, if you will, of the virus. So thank you for sharing that. I can certainly kind of acknowledge that as well. In the beginning, that was kind of tough. I feel it's leveraging now, that it's kind of leveling out, because I think there's some new faces that are have contracted COVID, and that kind of may have legitimized it a little bit more, unfortunately. How unfortunate is that? But here we are. So we'll talk a little bit more about, hopefully, from Neysa and Michael, of, you know, how can people respond to that from a mental health, emotional health, and behavioral health type of way that results well for themselves. Sometimes you can't fix other people or convince other people otherwise, but what can we do for ourselves? Is that okay to present that to you, Neysa and Michael?
Sorry, I keep muting. I apologize. Michael, did you want to take the question, or did you want me to go ahead?
I'm having a little trouble with my volume. What was the question?
So the question was, Kelvin mentioned how in some of his interactions with, I'm going to say, relationships that he has established, that individuals have downplayed or, and Kelvin, I believe you can still speak. If I'm not articulating this well, please correct me, have downplayed or have not acknowledged the existence of COVID and the fatality associated with it, or the, you know, the seriousness of and the communicability of it, and how, you know, as individuals, how do we respond to that to keep ourselves well mentally, emotionally, and even behaviorally, so that, you know, we can certainly be well as we continue to serve others and live out our lives, and, you know, set up the safeguards we believe are necessary to avoid communicability of COVID-19.
One of the things that's happened with this is that many people have been affected differently by COVID. We here in Essex County have seen it in the most drastic of ways. The numbers of infections and the numbers of deaths are very high. We've seen it in our community. We've seen it on television. We always look at things as that which affects us. We see with tunnel eyes. This is in my community. Neysa and I have come to the hospital on a daily basis where we've seen the devastation. There are a lot of people who it hasn't impacted as much as it has us here. So there will be varying responses to it, and human beings are human beings. There are many reasons why they'll be skeptical about things that are going on, not believing in what's going on. But you know, our experience dictates our responses. We here in Essex County, in this greater Newark area here, we've seen the devastation. So some others may see it in a different light, hopefully, in that they've seen it in a different light and are a little skeptical. Hopefully it won't hurt them in how they're keeping themselves for that. Maybe Neysa has another thought.
I agree with you, Michael. I think, you know, all of this is so new that it's hard to say. There's no definitive answer on what's the best way to approach it and to, you know, even quarantine. You know, there's no perfect way. There's no right or wrong way. You know, we might look back 20 years from now and say, oh, we didn't need to do that. We should have done that. But right now we just don't know. We don't have all the information and the answers. So all we can do is do what we feel is best for ourselves and our families, you know, and try not to, you know, be so hard on ourselves if we don't, you know, if we're unsure, or even as hard as it is sometimes, try to be as understanding as possible of others doing it differently, you know, but just basically try to do the best, you know, we can for ourselves, at least that we feel we are doing or can do, because there is no, we have no definite answers, you know. It's so hard, it really is, and we're all so different, so we're all going to see it, you know, very differently. That's really the best I can say, you know, right now is, you know, my family might be doing quarantine a little bit different than yours, and that's, you know, that's okay, as long as I'm not, you know, doing anything or imposing anything on anyone else and causing anyone else to feel uncomfortable or you know, but there might not be, there's no perfect known way at this point.
Right. What's interesting is we had gone to the beach in Delaware a month or so ago, and my wife is like totally terrified of it, and so she wears her mask, and I wear my mask as well. But then you would have like a group of people that would walk up with no mask and invade your space, and so my wife is like terrified.
Yeah.
And yet people don't give don't take into account your feelings about the same situation.
Yeah.
And so it becomes offensive.
Yeah.
And can turn into, you know, because my wife asked them to please move away from me, or at least give me my 6 feet, and they made it into a confrontation.
Yeah.
So
It's unfortunate.
And I thank you, Neysa, for.
Reverend, it's good to hear your voice. Miss you very much. You know, I mean, we look at this thing, and our response to, and people's response to this pandemic has a lot to do with what channel they watch on TV, what newspaper they are reading, what websites they are visiting, because the information that we're getting can be so diverse.
right.
And I've been in that situation on both ends, Reverend, where I've been astonished by how people are so lax in their response to this around me. And then I've been on the other end when people have been so vociferous about it. So we're going to run the gamut on that, depending upon the information that people have. So we just have to remember that we're taking care of ourselves, keeping ourselves well and healthy. And I trust you and your wife will.
Thanks, you too, Michael.
Thank you both. I appreciate Neysa acknowledging that there's no roadmap. And I think that's the reality, that because there is no specific roadmap, the pendulum swings as to everyone's approach, because as Michael so eloquently indicated, it depends on what is your sources of information that will drive or influence how you react and how you respond to addressing COVID-19. So thank you both for those tips. There is no roadmap. And so, you know, many of us will have to take the precautions that we need to keep ourselves well, mentally, emotionally, physically, and from a health standpoint. So we do have a comment. I'll start with the comment in the chat first, and then I'll go over to the Q&A. So Barbara Chubb wrote, was very hard, lost 2 co-workers, then got sick myself, and then my husband sick. My mental health was challenged, and church only online, then church open, but unable to go there because not wearing masks inside continually. So I choose not to go. Mental health, unable to, sometimes cannot sleep. So appreciated tips on eating healthy. So thank you, Barbara, for that transparency. I believe that is for a lot of folks. I can't remember if it was, I think it was Michael talked about the in-person with, you know, being able to gather and connect, and the human need for hugs. How much research has dictated to us the necessity of hugging and the on our mental health, on our emotional wellness. So having that gap and not having perhaps the best coping mechanisms in place certainly has caused many of us to respond differently, maybe even adjust our mental and emotional health differently. So thank you for sharing that, Barbara. I do want to say you're not alone. You are not alone in that. Know that hopefully there are resources available to you to help you navigate that as you continue to plug away. And I'm glad that you're well. I'm glad that you're on and you're well, and hopefully your husband recovered well too. And our condolences for the loss of your two co-workers. Sorry to hear that. Thank you, but thank you for sharing.
Can I say something to Barbara?
Absolutely.
Barbara, appreciate, there's a lot of difficulties we're all running into. I'm concerned about you saying can't sleep. Sleep's important. Maybe if you have, if you're going to your doctor, you can talk to them about that. That is one of the symptoms of, oh, they can't hear me. That is one of the symptoms that we're dealing with in a lot of people, having difficulty sleeping. So that's one thing I'd like you to address and see if you can find somebody to get some help with that. Getting a good night's sleep has been difficult, but it is important that we increase that. And I do wish you well. I hope your husband is well, and you can get back to church and back to whatever it is you need to do in good health.
Thank you, Michael. Thank you. Okay, I'm going to go over to the Q&A. This is from Elizabeth Owanyemi. My apologies if I'm enunciating that improperly. My goals: need to keep going no matter what, one day at a time, because circumstances beyond our control will definitely happen. However, I don't want to get derailed by unexpected. Believe that it is a phase and we will overcome. Let's pass the spiritual. I'm not sure what that word should have been. So maybe spirituality. Let's pass the blank our children as well. Encourage and motivate them, as well as correct them with love if they goofed. May God help us all at this challenging time. Thank you, Elizabeth. For many of us, that's where our strength comes from, is from above, or whatever our faith or spirituality is. So thank you. Thank you. Would anyone else like to at this time share an individual goal that you have set, or a professional goal that you have set? We have Elizabeth here talking about how she's approaching, how she's responding, what she's doing to progress in response to COVID-19. Okay, so we have a goal by Barbara. The goal is to treat everyone with respect, even when not taking Maass seriously. Understand that one completely. Sometimes the confrontation is not worth it, right? So thank you for sharing that, Barbara. Okay, if we don't have any further comments or questions, again, I want to thank Neysa and Michael for bringing us a wealth of information, a lot of tools, some refreshers, some helpful ways that we can adjust our lens and maybe get out of our tunnel view and look at things with a greater perspective, and to begin to approach our family, our profession, our congregation, those community constructs from a healthy perspective. And one of the key takeaways always is apply our own oxygen mask first. Take our own temperature, know thyself. And if there's need for resources, let's be a gatekeeper on that, find it, get the help we need, and similar for our families, our loved ones, and in our profession and congregations. That's one of the integral components of ADAPT, is that there are so many threads of resources that are available to continue to connect with us, and we do make ourselves available should you have a need that you are not sure where or how or who to reach out to ADAPT for resources that are available within the community. So thank you again, Neysa and Michael. And Jessica, I turn it back over to you.
Just a few announcements about upcoming ADAPT events. We have this QR code that you can actually scan it with your phone camera app. And when you hover over it, a website pops up and you click in it. as you're hovering over it. And then that should open up our Eventbrite Adapt Events page. And then you could see all of our upcoming events just by doing this one thing. So another way too to find our events are on our Facebook page at Essex.adapt. So a couple of things coming up this Friday, tomorrow, I can't believe it's Friday already, 5 p.m. we're having a kickoff event for our Incorruptible Essex Youth. All Essex County youth ages 13 to 18 are invited to attend. So if you go into the Adapt Events website, you'll see the event and you can click in there and sign up any youth that may be interested in doing some community service, working on vaping and tobacco prevention. And also in the future, we'll be also doing some underage drinking and prescription drugs prevention as well. Just to let you know, Red Ribbon Week is happening starting tomorrow, October 23rd through October 31st. Typically, these events are happening in schools. However, because most schools are virtual, we have different various virtual activities. If you're interested in being sent some of these activities that you could do with students or with your own children, please email Emmeline at efalcone@familyconnectionsnj.org. October 27th, next Tuesday at 7 p.m., we are having a webinar, Building Resiliency to Reduce Substance Use Disorder During the Pandemic, with our Family Connections team as well. November 10th at 10 a.m. is our next Interfaith Committee meeting. We will be talking about this, debriefing about the symposium and planning for our next roundtable training. If you are interested in becoming a part of our committee, please join us on that date and time. Okay. And just a reminder, this afternoon, we will continue our day 3 of our symposium with Phil McCabe from the Rutgers Center for Public Health Workforce Development. He's going to talk to us about our new normal, managing grief and loss. And then next week concludes our symposium month, October 29th. We're going to be having a presentation in the morning on self-care and mindful meditation with Kelly Satcher of Family Connections. And then in the afternoon, we will have our resource fair with providers from prevention, substance abuse, and mental health, talking about their programs, their resources, their information when they're open, if they're doing telehealth. So please come and attend at 2 o'clock. And then shortly after, we'll do some closing remarks and have a drawing for our raffle. We are raffling off a restaurant gift card, so you don't want to miss that. And just a reminder to please go to our YouTube channel at Essex Adapt. Please subscribe to us so you can get notifications of our future webinars and all the videos that we put up there. We also have public service announcements on there, a couple of videos about activities that we've done with our youth. So check it out, subscribe. And don't forget to follow, like, and share us on social media, Facebook, Twitter, Instagram. Take a picture or post something about the symposium and add hashtag 2020 Interfaith Symposium. And don't forget to tag us at Essex Adapt. So once this webinar concludes, there'll be a survey that pops up. If you can please just complete it. It's a very short survey just to let us know what you liked and what we can improve upon. And I thank you for your time. I hope you have a great rest of the day and a great weekend. And we hope to see you next Thursday at 10 a.m. for our last symposium day. Thank you so much. Bye-bye.
Bye. Thank you, Jessica. Thank you, Clara. Appreciate it. Nice to meet you all.
Same. Everyone be well.